hazards, any cords on the floor, spills. I don't see anything of concern. I see my patient. She's seated upright at the edge of the bed. Her back is straight. She's not tripoding. Her skin color looks normal for ethnicity. She doesn't appear to be cyanotic, pale, jaundice. I don't see any obvious diaphoresis or hear anything that sounds concerning like she's in distress. I also don't see any use of accessory muscles. Accessory muscles she would use if she was maybe having trouble breathing to try and get air, and I don't see that. So I'm going to go ahead and proceed. Hi, good afternoon, Ms. Daphne. How are you today?
Good. How are you?
I'm very well. Thank you for asking. My name's Kristen, and I'm a nursing student at Palm Beach Atlantic University. I came in today to do an assessment of your skin and respiratory system. Is that okay? All right. So before I begin, I'm going to just provide privacy and clean my hands. And then while I'm finishing up, do you mind pulling up your ID bracelet, please? Thank you very much. And can you tell me your full name?
Gaffney,
And your date of birth?
3/24/03.
Thank you, Ms. Gaffney. I have the same information. I didn't see an allergy bracelet. Do you have any allergies I should know of? All right. Can you tell me a couple more questions that are just routine we ask all of our patients? Where you are right now?
Palm Beach Atlantic.
Okay, and what year is it?
2024.
And why are you here today?
Just a checkup.
Okay, very good. So my patient's awake, alert, and oriented ×4. And Ms. Gaffney, before I begin, it's important that I know, are you experiencing any pain right now?
Yes.
Okay. I'm really sorry to hear that. Can you tell me what the pain that you're experiencing, what it is, where it is?
My shoulder.
In your shoulder. Okay. Can you tell me a little bit more about the pain that you're in? So first, let's find out how bad the pain is right now as you sit here. On a scale of 0 to 10, 10's the worst pain you've ever had in your life. 1's like barely any. Where would you say that that pain is?
Like a 7.
7. Okay, that's pretty significant. So I need to know a little bit more. Can you tell me when the pain started?
Yes.
It started yesterday. And was there a certain particular incident that occurred that caused the pain, or it started out of nowhere?
Yeah, I was playing pickleball.
Pickleball.
Yeah.
Everybody's playing pickleball now. Okay. You're playing pickleball and you maybe swung the racket wrong. Okay. And then, so what does the pain feel like? Just whatever. Is it throbbing, sharp?
Kind of throbbing.
It's a throbbing pain. Does it radiate anywhere? Can you point to where the pain is?
Yeah, right here. It kind
Okay.
of goes all
And it
over.
moves down your arm. Does it go into your fingertips? Okay. Are you having any problems with the range of motion? Okay, so then I would proceed with like a musculoskeletal assessment. We're going to pass on that for now. And then can you tell me, have you done anything for the pain?
Just like
Tylenol, did it help? Okay, from a 7, what did it bring your pain to? A 5. All right, well, it helped a little bit. Any relief I'll take. And is there anything that makes it worse? All right, and when you move it, how much worse does it become? All right, so when I go through the rest of this assessment today, I'm going to be very mindful of your shoulder, and I'd love to get some medication for you. Do you know when you had the Tylenol last?
a couple hours ago.
Okay. All right, and then I'd go into more information at a later time about how much you took and so on and so forth. But if it's okay with you, keeping an eye on your shoulder, being mindful of that, would you mind if I begin? Do you have any questions? Okay, so I'm going to start with her hair and scalp. Do you mind if I palpate your scalp? Okay, I'm not going to. So I'm going to feel on my patient's scalp. I'm feeling for any bumps, lumps, lesions. I'm looking at her skin integrity, looking for any moles, lesions, rashes. Her skin is intact. I don't see any of those things. I see that her hair is evenly distributed. No signs of alopecia. She appears to be well groomed and have good hygiene. At the nape of the neck or the occipital region, I don't see any nits or lice. And then also while I'm here at the base of the neck, I'm going to check for any signs of skin breakdown. So looking for any redness here at the back of the neck, behind both of her ears. I would also, again, with the skin exposed, be seeing her shoulders, her scapula, both of her elbows, her sacrum, and her heels, as these are areas that have a lot of contact with the bed if she's in a supine or sitting position. Okay, so I don't see any signs of any redness there, so we're going to move on. I'm going to check her feet and her ankles for any signs of edema. I don't see any edema, but if I did, I would want to go ahead and push on that to see if that edema is pitting or non-pitting, and then quantify how much pitting, if necessary. Then I'm going to check her toes. Again, a little bit of fake assessment here, but check her toes, check the tops of her toes, to see if she has a cap refill of less than 3 seconds on both sides, which will say she does. That's a negative finding. And then on the finger beds here on the hands, I can check that. So again, pushing down on that nail bed there and seeing that the skin color goes white and then comes back pink in 2 seconds or less, which is a negative finding. Next, I'm going to use the backs of my hands. They're more sensitive to temperature. I'm going to start at the top of your head, and I'm going to work my way down her body, chest, arms, all the way to her fingertips. And the reason I'm doing this is I'm feeling if she's bilaterally warm. And also if she's bilaterally dry, noticing any areas that are cooler or moist, but she is normal, warm and dry. All right, next I'm gonna check your skin turgor. This is a test for hydration status. So on your forearm, if you don't mind, I'm gonna give your hand or your arm just a little squeeze and a release, and her skin snaps right back. So that means that her skin is showing a good elasticity and she's well hydrated. The next test you can help me with, this test is for clubbing. You're gonna take your 2 pointer fingers and then put your first nail together, almost like you're making a heart. There you go. And I'm looking for a small, tiny diamond, and I see that that's present, so she's negative for clubbing, which is a normal finding. Last, can you tell me, do you have any moles that you're concerned about today? Okay, so she does not, but if she did, then I would go through that acronym, or since she does not, then I'm going to teach you about it anyway. Since you came in for a skin assessment today, I'm going to teach you about a helpful screening tool. It's called the ABCDEEFG acronym, and it's something that you can use if you notice that a freckle pops up that maybe you're unsure of or you're questioning. So the first letter is A. A stands for asymmetry, so that means that you want to have a mole that is symmetric. The border, B, is well-defined, not jagged or unclear. C is color. You want a mole that is of one color, not changing in color, ideally brown. Diameter of less than a pencil eraser. E for elevation, that it's flat. That it's not firm, meaning that it's the same texture as the skin. And then the last one, the E and G that go together, evolution and growing, meaning that the mole is changing in any way. And that's the most important one. So if you develop a mole and it's changing, I recommend you go ahead and get that taken a look at. Do you have any questions? Okay, so we can move on. We're going to go to respiratory now. I'm going to make my way to your back, and while I'm making my way, I'm going to notice that her AP to lateral ratio is 1 to 2. That means she is not barrel-chested, which is a negative finding. The next test, Miss Gaffney, is going to be for spinal tenderness. Can you roll your shoulders like slightly forward, like you're slumping over? Yeah, there you go. That just helps me find your spine. Okay, and then I'm going to wiggle my fingers down your back. All right, and then just let me know if this causes you any pain or tenderness at any point. It's like a left to right wiggle, guys. Anything? Am I still on your spine there? Okay, yeah. Oh yeah. Anything? Keep going all the way down. Okay, and then at the sacroiliac joint, any pain there?
No.
All right, next I'm going to find the bottom of your rib cage. Can you kind of help me out since you're awake and alert? Point to where the bottom of your rib cage is. I can't see. Okay, like here. All right, so leaving that mark there, starting in between the scapula and the spine, you'll feel some taps on your back. Let me know if at any point that's tender for you. Any tenderness? No. Okay, moving to the other side, again marking that bottom rib, starting up a little bit higher, some taps down the back, and then out just below where my hand is. Any pain? Okay, and that's negative for CBA tenderness. Next, I'm going to listen to your lungs. This takes a while. I'm going to have you take 10 deep breaths in and out through your mouth. If you get tired and you need a break, tell me and we can stop. And we'll come back to it later. So base of the ribs up 2 spaces at the 10th rib space. Okay, Miss Gaffney, go ahead, big deep breath. Till the end of exhale. Once she's done, moving to the other side for comparison. At the end of exhale, moving up to the 6th rib space. And again. Across the spine, other side. Thank you. Up to the 2nd. Other side. Into the fossa. The fossa is the top of the lung fields. It's where the neck meets the shoulder. There's a little spongy area there. It's superior to the clavicle. Go ahead. Okay, and then on the other side, again. Can you, well, you have a hurt shoulder. Can you raise out your left arm like a T? Like a letter T. Like, I guess if both arms are out, it'd be a T. Mid-axillary line at the 6th rib space. Go ahead, deep breath. And then she has a hurt shoulder. So pretend you don't for a second. Put this arm up. If she did, I wouldn't make her do this one if she wasn't in respiratory distress. Go ahead. Okay. So we've done all 10. It takes about a lot of breaths, right? So her lung sounds are clear to auscultation. Next thing we're going to do is going to be chest expansion. So the bed's kind of low, but that's all right, I'll make do for now. Again, finding the bottom of her ribs, okay, is the 12th up to the 10th. I'm gonna put the base of the palm of my hand at the 10th rib space. Same thing on the other side. My thumbs vertical with her spine, fingers towards her axillary region, and then squeezing in and up. Okay, big deep breath. And back. Very good. So I could very easily feel my hands rise and fall. That's negative for pneumothorax. She has equal chest expansion. Next is tactile fremitus. Can you say for me, real loud, 99?
99.
Louder.
99.
There you go. Go ahead.
99.
Drawing kind of an hourglass. Go ahead.
99.
Very good. Again.
99.
And then your non-hurt shoulder. We're going to put your arms out like a T. Okay, one more.
99.
Very good. So in all those locations, I can feel vibration sense on my ulnar surface, which is a negative finding for consolidation. Last is percussion. Because the bed is so low, I'm going to sit with you here. I would normally ask my patient for permission. 12th rib space, 11th, 10th. I'm going to put my hand on your back, and you can just breathe normally. Up to the 6th. Up to the 2nd. Awesome. Sorry, stabbed you. Arms like a T. Another set. Okay, so all her sounds are resonant. That's negative for consolidation. And then the last thing we're going to do is listen to your front for your right middle lobe, starting underneath the right clavicle. Another big deep breath. Go ahead. Moving in a ladder formation, so comparing to the left. Down one intercostal space again. And then back over like I've drawn a rectangle. Okay. So her right middle lobe is as well the rest of her lung fields are also clear in the front. Next week when we come back, you're going to start with cardiac. So you've just finished those breath sounds. I'll say, okay, we're done with the breathing.